at exactly 6 o'clock. Can everybody rise for the Pledge of Allegiance? I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Okay, next we're going to have reading of the mission statement. Megan Burke, can you please read that for us?
Yes, Madam Chair. Our mission, Macomb County Community Mental Health, guided by the values, strengths, and informed choices of the people we serve, provides quality services which promote recovery, community participation, self-sufficiency, and independence.
Thank you. Moving on to item number 3, adoption of the agenda. I'll take a motion.
So moved.
I didn't hear who any that was, so say it, just say it
Somewhere on the
together.
side. Motion support.
Okay. All in favor?
Aye.
Any opposed? Okay, item number 4, hearing of the public. Is there anyone from the public that would like to address this board? Come on up and give us your name.
Thank you so much. First, I thank you for listening to me. My name is Rebecca Davis. I'm here on behalf of Michaela, an 18-year-old autistic disabled adult who I currently have guardianship of. Very briefly, Michaela has spent her entire life either homeless or living in hotel rooms down in Detroit, whatever. I, along with my husband, back in February of last year, reached out and took Michaela into our home, along with her mother and her sister. Since then, I have been working with Macomb County Health Department with a social worker that was provided for Michaela. Also provided for Michaela was a court-appointed attorney, a guardian ad litem, an APS, doctors, you name it. Everybody under the sun has been with me to help me with Michaela. I've dotted many I's and crossed many T's. And I loved your mission statement because that's what I'm here for. I'm here for quality services for Michaela. She's currently placed in a home where a couple of the ladies are currently receiving CLS services. But Michaela, although she has been approved through your county for CLS and respite care, is not able to receive these services from My Independent Living. And that's the name of the company that currently has the provider for the CLS workers there. I've made over 70 phone calls. I've called every provider on your list. I've gone through the Lara's list looking for a placement in homes. And I kind of jumped ahead of myself, but we did finally find Misty. I walked into her home. First thing I felt was warmth, compassion. It's not a fancy home, but it sure well is clean. And all of the staff there are just loving, caring individuals. We all know that in our county, in our state, and in the United States, as a matter of fact, this is a catastrophic that we don't have the people to hire, or we don't have the help that's needed to provide these quality services. And I've been reaching out to everyone. I'm about in tears because I don't want to give her up. But because I'm dealing with getting the CLS approved with My Independent Living, I've had to sacrifice my job for 6 months. I need to sacrifice my life and my well-being because I'm so concerned about taking care of Michaela and have reached out to everybody for help. I reached out to the ombudsman on November 1st. I received a call back on January 3rd. I made numerous phone calls after November 1st. It wasn't just a one and done with Rebecca Davis. No, I kept calling. I needed answers. I needed help. I got a letter today saying from my ombudsman that they'll see me on April 4th. What do I do with Michaela until then? Today, Michaela came home from school and there was nobody there. Why? Because CLS. I don't have the hours and I'm at work. And they won't approve. So I'm sorry if I sound mishy-mashy or whatever, but the gist of me speaking here is I'm hoping to come out of this with a meeting with somebody who can do something to help me. I've met with, as I told you, many people, and nobody's been able to help me. I brought a letter here from her teacher, who's had her for a couple of years, just to show the marked improvement. Even her bus driver got off the bus and said, "What happened to Michaela? She's talking. She's clean. Her teeth are brushed. She feels good." And what's happened is the caregivers that I found with Misty Lawrence's company over on Lowell Street, where she's living, thriving, blossoming. So please, all I'm asking for is a meeting with somebody. Not wait until April. I needed it yesterday. I need somebody's help. I'm asking for a meeting to request that perhaps you give her an RFP to submit or whatever we can do to get her taken care of. And I thank you so much for your time, and I hope I didn't ramble. Thank you.
Thank you, Ms. Davis. And I believe somebody will reach out to you and we'll help you get it straightened out. So thank you for being here tonight.
I really appreciate it, and Kayla has a court date on this Friday, so. And I've been expressing this with Danielle Gurney's office and the ombudsman and everybody, but to no avail.
Okay. Thank you for being here.
Thank you.
Anybody else from the public wishing to address the board?
Like I'm on like trial or something. So my name is Misty Lawrence. I'm actually the owner and CEO of My Independent Living. We, in a nutshell, in 2012, I developed a company because I was a CLS provider with a client. There was a self-determination guidelines back then that they have changed the criteria since then. So because the way that I developed it then, I was allowed to take on clients through the self-determination program. I utilized an FI to utilize like the payroll. So, sorry, I'm like trying to cover everything. Normally I'm not lost for words, but so the guidelines changed for the self-determination. Therefore, I was no longer able to accept any clients. So then I had multiple meetings and stuff with lots of CMH staff. I mean, I can tell you Marianne Poland, like, I don't know if anybody remembers her. She was like the first self-determination coordinator, Laura Manza. I've spoke with all of them. I have submitted RFPs. I had attorneys help me do it. I know that they were good. When I've reached out to them, hey, why didn't I, make the panel, blah, blah, blah. We're not at liberty to discuss that. I'm not gonna, make a fit. I don't like to argue and I don't like confrontation. So I was grateful that they continued to allow me to have the clients that I did. Moving forward, I have reached out in other avenues. I am a licensed agency with the state of Michigan. I perform home help services all around the state. It's just Macomb County, when they put out an RFP, I submit it, I get denied, don't know why. Speaking with Danielle Gordy recently and regarding this situation, I have it in an email. We were told that an emergency situation comes up, which I believe this is, that a RFP would be submitted or would be able to be submitted on my behalf for an emergency contract for self-determination with Michaela. Michaela lives in the home where I provide CLS for 2 other individuals. The reason that Michaela is able to be supervised is because of them. So I have my staff in the home with my clients that are being, provided care for. So Michaela is kind of utilizing that, and the county is well aware. Michaela is able to get her own services, which she's already approved for. There is an emergency need for it. They've done it for me before for clients. I know they could do it again. Don't know what the holdup is there. So Michaela also does receive home help services from our agency, which also allows us to, tend to her ADLs each day and get her off the van and things like that. Today we were there. They just had to beep the horn. The staff was in the back and didn't know they were there. But normally that is going to be an issue because if there's no CLS and the clients that live there that receive CLS are at their day program and not home yet, that leaves Michaela vulnerable and alone. So basically, I guess I'm asking, I don't know if there's a way somebody can reach out to me. I am more than willing to do whatever it is to put out a request for proposal for CLS once again, and help Michaela with that. We have the means for staff. I've always had the means for staff. During the pandemic, I can't even tell you how many people called us to help them privately just because we were the only care providers that didn't stop. So I'm just the low man on the pole, but I have always had the means for staff and want to help, the community. So that's it about us. So
Okay. Well, thank you for being here, and
Yep.
if somebody will reach out, and we
they
appreciate you
can
being
reach out
here.
to her or whatever, and then we can coordinate and go from there. So
Okay,
thank you for your time.
thank you. Anyone else from the public wishing to address the board? Going once, twice. There will be another hearing of the public at the end of the meeting. Moving on to item 5A, request to approve CMH Board and Committee meeting schedule for February 2024 through January 2025.
Support.
Okay, motion by Megan, support by Antoinette. Phil, you want to talk about this?
Sure, real quick. Thanks, Dana. Nothing out of the ordinary with this one. Every second and fourth Wednesday, except Christmas falls on that fourth Wednesday. So instead of doing it a day or two before, I moved it to the week prior so we can all enjoy the holiday week this time. And we did talk to the Board of Commissioners about the schedule as well, and everything is fine with them except for when it comes to budget season. There may be a couple meetings that run late, as you've all been part of before, and had to wait a few minutes, but everything else seems okay. Thank you.
Okay, thanks, Phil. Any questions for Phil? Okay, I have a motion and support. All in favor?
Aye.
Any opposed? Okay, 5B, request to approve funding for crawl, walk, jump, run, up to the amount of 10,000. I'll take a motion. Motion by Selena, support by Lori. Tracy, you want to talk about this one?
Sure. So you'll see it's one of the grants that someone submitted for funds that were available last year. And basically, we considered it because you can see that it's allowing that particular location to add additional sensory devices and improve one of their sensory rooms. So we do think it's of value for that organization and ultimately for the people we serve.
Okay, thank you, Tracy. Any questions? I have a motion and support. All in favor?
Aye.
Any opposed? Item 5C, requesting approval to issue a request for proposal for multi-systemic therapy. I'll take a motion. Motion by Donna, support by Lori. Tracy, I think you're up again.
This particular evidence-based program is something that we have been partnering and looking into with the Juvenile Justice Center. I'm sure you all know that there's a large need there, so this particular evidence-based program will allow a more intensive services to be provided in the home. So both while somebody's incarcerated or while somebody has coming out. It's proven throughout the country. There are a few providers that provide it in the state of Michigan. So this again is a request to put out the RFP this month to then get proposals, and then we would come back to you with any recommendations based on the individuals who might have submitted to that RFP. And just to give you some additional information, over the next year, you'll continue to hear some things directly related to jail diversion, directly related to anything to do with individuals involved in the law enforcement system, because there is a gap there that the whole state, including us, is trying to be creative on and trying to look at anything that we can do to make that a better service line for the people we serve.
Okay, Any questions for Tracy on this one? Okay, all in favor?
Aye.
Any opposed? Item 5D, request to approve clinical informatics certification training for 4 MCCMH staff members in the amount of $15,600. I'll take a,
So sorry. I got so excited so well. I'm so sorry.
oh, Megan, you crack me up. Motion by Megan, is there support? Support by Mark. Tracy, you're up again.
So this particular training, just to explain, is remember we have a FIO, which you guys are well aware of, and we have clinical informatics staff members. They have been diligently working to utilize the systems we have available, but we're also trying to train them up, for lack of better terminology, and that's what this would be. The more familiar terminology is Tableau is a competitor of BI. If anybody's ever heard of Power BI, it's more commonly used. So imagine this would allow them to be more well-versed to create our own reports, our own data. So we're not approaching it from, we do use a vendor, but we want to have our own in-house and kind of balance it somewhere in between.
Okay. Any questions for Tracy on this one? Go ahead, Megan.
Not so much a question, but Cornell, like the eCornell, is really awesome for training and development and stuff. Like, I definitely support that and the training and development of our staff. Like, I just really think, I've heard a lot of really wonderful things about all their programs. Their HR and labor, it's like fabulous, so super supportive of that.
Okay, thank you, Megan. Anybody else? All in favor?
Aye.
Any opposed? Okay, item 5E, request to approve renewal of Alpha Health Customer Service Agreement. This has been approved by legal. I'll take a motion.
So moved.
Motion by Phil, support by the peanut gallery over there. Okay, Tracy.
Sure. If you're not familiar with this, it says Alpha, but for our team would be more familiar with ABO, America's Back Office, is what they often refer to them as. So we have actually not executed a new agreement with this organization for more than 5 years, which is not a good practice. You'll see that the only really difference in this agreement is two things. One, we have taken out the tighter timeframes for us to pay. It used to say we had to pay the week before the individuals were paid themselves, which we've never been able to do that because we don't even submit the data. So now you'll see we have a longer time frame. The other change is we were paying $8 per pay per person, and that is the only fee that we pay. Now we'd be paying $10 per person per pay. So that translates into less than either around $4,000 annually total, or a maximum about $6,000, depending on how many people you have and that type of thing. So that's about the range. So really, we're doing this because it's a good practice to have an updated agreement with the organization, and they have changed their legal name, essentially.
Thank you, Tracy. Any questions? Nick?
I turned it on. You never know with these mics whether they're on or not. These are essentially temporary positions,
Correct.
and they don't conflict with any of our collective bargaining agreements.
They do not. They're
So this
well
is
aware
the
of
continuation
uses.
of what we
This
did
is the same
before.
that we've had in the past, and of course, honoring still our union agreement.
Thank you.
Okay, thank you, Nick. Any other questions on this? All in favor?
Aye.
Any opposed? Okay, I'm going to move on to item 6, receive and file. Item A, new provider, Zawadi USA. Approved, it was approved by Phil already, approved by Phil Kraft, CMH Board Chair. You want to touch on this at all, or you just want to receive and file this, Phil?
Just real quick, the only reason I did it was because it was an emergency situation and time was of the essence, but I wanted the board to see this action. Thank you, Dana.
All right, thank you, Phil. I'll take a motion to receive and file. Okay, motion by Selena, support by Lori. All in favor?
Aye.
Any opposed? Okay. Item 7, resolutions. We don't have any. Item 8, other possible agenda items. Item 8A, interim CEO update.
Hi. This is my, this is my first time.
Welcome to the show.
I know. I feel like it's the big show. So out of the gate, I just want to express my greatest appreciation. Our staff and even the providers and everybody have been amazing, extremely welcoming, the other CEOs. I can't express my greatest appreciation for that. I'm in day 8 as of today. Woohoo, I made it through that much.
Not counting or anything.
Right, right. But I did want to give you guys some updates. I am going to continue the pattern that Dave had in the way that you'll also receive like a written report that kind of summarizes, because I'm sure, as you know, verbally you can't quite go into everything. And I also like to give you some source documents, so in case you're just wanting to read more on that subject, you can of course do that. But a few quick updates are regarding conflict-free assessment and planning, in the past member referred to as conflict-free case management. The state of Michigan, or MDHHS, continues to kind of be a little silent over the last couple weeks regarding that. The only thing that changed that in the last week that I was made aware of is they used to have a date to say, as of blank date, this needs to be implemented. The date has disappeared, and the only type of dates that have been used as by October 1st of 2024, but they've been kind of evasive in that. It seems like if I would describe it, I definitely don't want to say the word abandon, because they're not abandoning it, right? But I'm not sure if they're just pausing and trying to figure it out. And then that leads me kind of into the next update. Our system, you guys already know, is very, very complex, right? One of the other complexities is the CCBHC, which you guys all know, we are that. There is a federal rule that says the CCBHC has to provide 51% or more of the services directly, right? State of Michigan doesn't currently enforce that. They're currently looking to move towards that. And that sounds simple on paper, but just know that we need more guidance in the way that, what billing codes are those? What do they mean by that, right? So there's still a lot out there. So I connect those two. So do you see how, remember, conflict-free is we wouldn't be providing a lot of the services. CCBHC would be, you have to provide the majority of the services. So both of those things are still outstanding. Neither have been finalized, and we're just kind of continuing to collect information, but they're both continue to be very hot topics for all the CMH and PHPs. Some other things are, we are still trying to identify some real estate in the next 2024. Remember, we really are trying to do a CSU, still an engagement center, right, Helen? And we are going to get those things accomplished and a few others. So I just want to give you a heads up that we had somebody lined up. There is some complications related to that, so at some point we will be coming back to you. But we want to make sure that we do this right, and we weren't confident in the path that it was moving forward to, but we will come back and wrap back around on that subject. The other thing is targeted case management. We've talked to you about that in the past. You guys remember? And just in case you don't, essentially the concept is the state of Michigan said, we are going to create this additional billable service for individuals who are incarcerated, and when they come out, they can receive up to 12 months of services after they come out, right? So we continue to meet with the jail. And if you already don't know this, we have 2 staff that are in the jail. We're trying to hire 2 more. And they would not necessarily be the persons providing all those services, but we just wanted to give you a quick update that we continue to have those conversations, continue to hire so we can implement targeted case management. And of course, if one of our providers was doing it right now, we would of course allow them to bill it also. But we're trying to get it going so then we can encourage others to do the same. And then other ones is, let's see. We are trying to meet, or we are meeting with Henry Ford, myself, and Tony. In case some of you might be very interested in this, we are privileged in the way that in the next 30 days or so, we're going to have our own veteran service officer. So if you're not familiar with the veteran service officer, right, the individual has access to the VA, and I'm sure Wayne could probably even more intelligently speak on it than me. But imagine we're not paying for them. They're just going to be stationed out of our West location, which is very cool for us because if you don't already know this, it's hard to get like in a meeting with one of those. And even though the county does have veteran service officers and they're amazing, it's still hard to get in, right? So imagine having this one person that they don't know yet, but we're going to monopolize their time with, with all of our people. So that's going to be a huge asset to the individuals. And basically we're going to book them up to help the individuals we serve. But don't tell them that part. We don't want to scare them away. Let's see. Next week, or I'm sorry, the week after, we're starting the leadership intensifier. You guys had approved the intensifier was to further develop the kind of that second tier of staff. So I just wanted to give you a heads up that it's actually happening. We're very, very excited about it, and we'll continue to give you guys an update because we're excited about how that can move the system forward and making sure we're having well-trained leaders. And then other meetings, I've been attended the PHP Director Forum, and there is also an upcoming CMHSP director forum that I am looking forward to. So I'll stop there because I've already talked at you a long time.
Okay, very nice. Thank you, Tracy, and congratulations. Any questions for Tracy? Go ahead, Selena.
Mm-hmm.
And prepared months prior to that date, because what have those
Mm-hmm.
pieces connected, you're struggling to get them.
Agreed.
So I know that there was here, they're ready to go, they can get their medication, because out with scripts, they don't come out with. So where are we at?
Sure. Targeted case management won't fix all of those things, but that's exactly what it is. So when they did targeted case management, they said you're going to do an intake while they're still incarcerated. And just to explain, an intake would be where I'd collect all my documentation. I'd see what makes sense to you and what exact services do you need, including do I need medication? Do I need a psych evaluation? What do I need? So that will actually be done by our staff. The staff that I was talking about in there, they'll be the ones that are doing that, getting them set up. Then they'll be handing them off to whoever the provider is of the targeted case management. Just to give you kind of the details though, that intake, even though targeted case management said you can do that, the state of Michigan has a rule that fights itself. So this targeted case management says you can bill for this. This entity over here says, no, you can't because they're in the jail and they don't have Medicaid, so you can't bill Medicaid. So just know that every single time we're doing intake, and we're gonna do it, but it's general fund. Be-
And so it's really important. Because they go hand. Finding is that they're coming out without blood sugar issues.
That's a great point. I think maybe as we get there, right, when we have somebody, maybe we're a meeting, happy to include you or whom we think to make sure that there is that connection, because it's key on to your point on that intake about who am I going to connect them to.
Okay, thanks, Selena. That was my question too, if with the staff that we have at the jail are actually doing the intake and then determining what services are appropriate and, okay.
And then they have to do that kind of warm handoff. Yeah,
Yep, okay. I think that's at least we're moving in the right direction though.
agreed.
Okay, good. Any other questions for Tracy? Right. Item 8B, reminder, CMH full board meeting Wednesday, January 24th, 2024 at 6 PM here in the Board of Commissioners room. And I think we have one other possible agenda item.
Thank you, Dana. Two things real quick. Welcome, Tracy, and welcome, Helen. It's awesome to see you both up here in the comfy chairs. And two, just wanted to give you all another CEO update from where I'm sitting. Megan and I have been meeting with county HR very regularly. Megan and I don't know, multiple days a week for the last few weeks. And we've been discussing search firms, and we have looked at several proposals. We've received costs and things like that. And I believe that we have decided on one. We're going to send the contract through legal first, and we should see that for full board in 2 weeks. I just wanted to give you all a heads up. They are a local firm. They're also the lowest in cost as well. And hopefully they will help us do what we need to do. And they what? And they specialize in exactly what we're looking for. So just wanted to give you a heads up that in 2 weeks we will have that for you. As soon as it gets through legal, I will get that to all of you so you can take a look at it beforehand. And if you have any questions, and I also plan to have representatives from county HR and the firm themselves here on full board night. So if you have any questions then, they can answer them for you.
Okay, great. Thank you, Phil.
Thanks, Dana.
Nick?
Yeah, if I can, to Phil, do you intend to run this through the personnel committee or take it directly to full board only?
Yes. It depends on which.
Okay.
I'm just sort of, right now we're putting the pieces together in terms of grabbing a search firm. And I also spoke with HR about posting the position. They haven't posted it yet. They kind of want to do that simultaneously with us hiring a search firm as well. So that will happen pretty much at the same time. Once we get those two boxes checked, then I'm going to figure out if we're going to go through the personnel committee route. We are going to have to do a full board eventually. Megan and I just have to decide whether or not we're going to bring, however many candidates to which committee. In the past, we did have, the finalists come to a personnel committee and a full board committee and things like that. So we're just going to work through that process. And if anybody has input on what they would like to see, happy to hear it, because we've only done this once since I've been here and I wasn't running the show at that time. So kind of looking back at the notes, and we'll try to tweak things for the better.
Just from my perspective, the way we did it last time worked pretty well, I thought.
Yes, I agree.
And I do think the advantage to having a personnel committee meeting prior to bringing it to full board is sometimes, just like with program and budget, if it raises questions that somebody's got to go back and find out, that gives us the opportunity, or gives you, or gives Tracy the opportunity to go back and get those answers before we take final action. So the two-step approach, I don't want to slow the process up for obvious reasons, but I think the two-step approach is the better approach, and it's something that's a pretty big decision, so I think it's a wise course.
Yeah, I guess I don't really have any intentions of bringing 2 or 3 candidates to a full board meeting and then us deciding on one of them that, at that moment. So I think personnel committee is the way to go.
Yeah, no, but I mean, what I'm saying is, even with these contracts and everything, before we take rather than going directly to full board, running it through personnel first gives a chance to raise questions that don't hold it up for a whole month.
I see
It
what you're
just
saying.
holds it
Okay.
up for a week or so. So I think that's a wise decision. In terms of interviewing, the personnel committee is a committee of the whole, I think.
I was gonna
is.
ask that.
Anyways,
It is.
so, I mean, the final decision on hiring obviously has to come before the full board, but
Right.
how we do the interview process, how it gets narrowed down and that sort of thing, those things generally worked well I don't remember if you were there or not, but Chris.
I'm happy to make it a Megan problem, Nick. I really am.
Well, don't fight. Chris was very good at consulting everybody and getting the questions through, and then we'd have a personnel committee meeting that raised the questions, so that some of them, we had the answers right then and there, and we narrowed it down to a few people to interview, did the interviews, and then took it to full board. And so I think that's the better approach than going directly to full board, just because if you have unanswered questions, unanticipated questions generally, at a full board meeting, you're then delaying it for a full month, rather than delaying it to the call of the personnel committee.
Okay, thanks, Nick. Megan?
But truly, like, are you guys able, like, are you taught, is that what you mean to have a quick meeting? Because if that is the case, I will have to.
Well,
We're not gonna do it that fast, I don't
Yeah,
think,
I
are
mean-
we?
and I would recommend the same thing we're doing with legislative policy, that you do a doodle thingy, whatever they call it, that Sandy does so well, to try to find a time when you can have a majority of the committee meeting. And I hope wherever you're going is warm. Well, then, don't go. What's the sense?
Are you good, Nick?
Yep.
Okay. Anybody else have anything they want to add? Okay, any other possible agenda items from anybody? All right, item 9, hearing of the public. Is there anybody else that wishes to address the board? Going once, going twice? Item 10, I'll take a motion to adjourn. A motion by Megan, support by Antoinette, all in favor? All right, we're adjourned. Thanks, guys.